Welcome to our series of interviews with our vitamin D researchers. Today we are doing an interview with Dr. Cedric Garland of the University of California, San Diego and Moores Cancer Center about prevention of cancer with vitamin D. Dr. Garland, welcome again. We're always glad to have you to talk to our audience about vitamin D.
Pleasure is all mine, Carol.
I'm going to hit you with a big question to start with.
Okay.
Does vitamin D prevent cancer?
Absolutely. It prevents it. It prevents it in the same sense that vitamin C prevents scurvy, or that the niacin prevents pellagra, or that thiamine prevents beriberi. It turns out, as luck would have it, that breast cancer, for example, is a vitamin D deficiency disease. It happens it's also true of colon cancer. It happens that it's also true of pancreatic cancer. And it's largely true of ovarian cancer, cancer of the brain, it's true of adult leukemia, it's true of bladder cancer, and it's true of cancer of the kidney. And you know, when you go into a subject in science, you never know where it's going to lead you. And no one assumed at the beginning of this that it was going to be simply a vitamin D deficiency disease. But there are models for vitamin D deficiency diseases, or vitamin deficiency diseases throughout history. And it happens that that's the model that is the appropriate one for breast cancer, bowel cancer, and the other ones that I mentioned. No question, it absolutely prevents cancer.
And of course, the audience is going to want to know, show me, is there a trial or a study that really demonstrates
we have
this?
a couple of hundred studies that are observational studies that show that this is true. But there's always this one last residual doubt that could it be that there's some explanation that hasn't been accounted for by the analysis, which we call multiple regression, a modern form of analysis that reduces to almost zero the chance of confounding, explaining a finding. But the absolute way to get rid of that is to do a clinical trial. And lo and behold, the clinical trial was done by Joan Lappy, Robert Haney, Robert Record, and their colleagues at Creighton University and a group of rural Nebraska women, and it's been done, and it found that an appropriate dose of vitamin D, which is 1,100 IU a day and 1,500 milligrams of calcium, prevented 4 out of 5 cancers, 80% of the cancer. And that's the trial. It's done. We don't need to do another trial. We don't need more epidemiological studies. We have the information we need right now to prevent 80% of cancer, and we're not acting on it.
And I think one of the important things we want to throw in there with that, with the Lappy trial, the serum level that the people got to with this intake, rather than focusing on that intake, the serum level they got to was right at 40 nanograms per milliliter.
Started at 30 nanograms per
Right.
milliliter at baseline, and 1,100 international units of vitamin D brought their average serum level to 40 nanograms per ml. So it's right at the value that the scientists as a group have for a number of years recommended, namely that we should all be at 40 to 60 nanograms per milliliter. And that study confirmed without question for the balance of the history of science that that amount is sufficient to produce that much of a reduction in cancer. And it's a joy that it reduced the incidence of all cancers. When all cancers were combined, they had the effect. But that included breast cancer and bowel cancer and lung cancer. Each of them were reduced. It wasn't limited to a single site, which is very promising.
What about those people who have the misfortune of already either having or having had cancer? Is it of any benefit then?
It's of striking benefit. We've just had a paper accepted that shows that women whose vitamin D level is up around 40 nanograms per milliliter women whose vitamin D level is up around 40 nanograms per milliliter, they had only half the mortality over a 9-year period from cancer. So even a modest amount of vitamin D reduces the mortality among breast cancer patients by half. And there's no chemotherapy that achieves anything close to that. Usually with chemotherapy, we're fighting to get a few percent. So yes, it absolutely is of great help to people who already have breast cancer. And the same findings are true for colon cancer. There are several studies now of each site, including the work at the Dana-Farber Harvard Cancer Center, that show just the same result. If you take about 40 nanograms, or you get to 40 nanograms per ml of vitamin D, you will get rid of, well, at least half the mortality. And we just need to explore the area above that now to see that in a cancer patient, if we go up to 90 or maybe even 100 nanograms per ml, we have to stay below 150 generally to avoid any chance of toxicity, that we will be able to prevent a greater percentage. And my feeling is we'll be able to prevent virtually all mortality from most cancers by giving a large enough amount of vitamin D and monitoring the serum level to confirm that this very high serum level needed to inhibit the cancer has been achieved.
Dr. Garland, there was recently a group in Europe that tried to summarize the clinical trials, and they totally missed the association with vitamin D and cancer. What did they do wrong?
The French group analyzed obsolete trials. They found 20 or 30 completely obsolete trials. They're obsolete because they used an outrageously low dosage of vitamin D by current standards. The dose they used was only a tenth the dose that we would use in a contemporary study. So there was no point in adding them together and trying to get a common measure, and summarize them and doing a meta-analysis. It's totally outrageous. It makes no sense at all. It's garbage in, garbage out. It wasn't garbage at the time the studies were done, but we have to be smart enough to realize that after such studies are done with doses that are too small to produce an effect, we don't go around summarizing them and saying that the vitamin D is ineffective. It's beyond imagination that anyone would do that, but somehow the authors did it.
I want to come back to the key take-home message for our audience, which is it's not just vitamin D, but it's the achievement of a particular serum level. And what does it take to get there? So can you talk to us about that a little bit?
Well, that's one of the great contributions of the grassroots health cohort. Before we had this cohort, we didn't imagine how variable the response to vitamin D oral dosage was. People sort of thought, well, if you take 5,000 units, you'll have a level that's approximately maybe 50 nanograms per ml. But what we know from this cohort is that it's wildly variable. Some people can really raise their vitamin D with, say, 5,000 IU. Other only goes up a little bit. So what's essential is to measure the level in the blood to confirm that it's high enough and to adjust the intake of vitamin D or solar exposure to the point where it's high enough to be in the range from 40 to 60 nanograms per ml, or if they're a cancer patient, to be higher than that in order to achieve the benefits of vitamin D.
And I'm absolutely delighted to say within the cohort, the Grassroots Health cohort, we can very clearly show that it takes about 5,000 IU a day to get 83% of the population right at 40 nanograms per milliliter. And it takes 10,000 IU a day to get 96% of the population at 40 nanograms per milliliter. And last but not at all least on my part of that 10,000 IU a day was considered the no adverse event level by the Institute of Medicine. So the possibility that the population would be taking that much in the future, Dr. Garland, what do you think?
I think it's very high. The Grassroots Health cohort is the gold standard for determining the response to oral intake of vitamin D. There's nothing in the world like it because no one has a cohort with such high oral intakes of vitamin D. And it's showing that if we want to take the public health approach, if we want to go for the gold, if we want to eradicate these diseases due to vitamin D deficiency, then what we need to do is to go for a larger intake, a larger dose. And we know from extensive reviews by the National Academy of Sciences that 10,000 IU is safe for everybody over 9 years old. So why not? That's my question. Now is the time for us to take that action. Cancer is too awful a disease not to do that. And we also know, just as a side point, that there are many other advantages for taking such an amount of vitamin D that would greatly overwhelm any tiny risk. The very de minimis or minimal risk would be outrageously small compared to the huge benefits both for cancer but for other outcomes like diabetes and multiple sclerosis that are also vitamin D deficiency diseases for the most part.
Dr. Garland, thank you so much for this and for I think also for the public health approach. I mean, to assure people that we've got to take a look at this 96+% of the population. Half of it isn't good enough.
That's right.
My thanks to all of you again for listening to this, and I hope you will take advantage of the opportunities offered by Grassroots Health to do your vitamin D testing and to help contribute to this marvelous set of information that we're able to share with you. So thank you again for listening in.